you also conducted an analysis on physician notes about HRT prescribing. What did you find here?
Yes, this was a really interesting component of the analysis. We took a sample of clinical notes from women with HRT use in 2024. We wanted to use the latest year available to us at the time. So again, this is a sample of women treated with HRT, and we're looking at their physician notes from the point of care and trying to make sense of them. So first, we looked at the notes around symptoms driving HRT initiation. So why did these women start the medication in the first place? Vaginal dryness was the most commonly documented symptom. It was followed by hot flashes, night sweats, and sleep disturbances. Other symptoms that were commonly mentioned were fatigue, joint pain, decreased libido, and urinary symptoms. That last one is important because we know that vaginal estrogen is extremely effective in preventing UTIs, which is one of the main causes of infections and hospitalizations in older adults. Now, earlier we talked about how HRT was widely used to prevent cardiovascular and other chronic diseases. Our findings here, when looking at the notes, identified a gap in that. A majority of clinician notes had zero mention of cardiovascular related benefits of HRT. There was no risk-benefit discussion as it relates to cardiovascular health. Outside of cardiovascular health, we looked at sort of the most common themes of just what was discussed between the provider and the patient. And the top theme was risk communication. So to this day, when providers are having conversations with their patients about HRT, they are leading those discussions with the risks associated with HRT. And what exactly is the risk that they are communicating? It's breast cancer. So it's really disheartening to see these data. We are over 2 decades out from when the WHI was stopped early, due to this alleged kind of risk of breast cancer. All of that has been disproven by modern science. We know the results were miscommunicated, and it's amazing how much damage that has done. I just want to share a quick anecdote. When my colleague, Jordan Overcash, and I, we presented some of these findings at the American College of Cardiology conference earlier this year. And, after our talk, we had multiple practicing cardiologists come up to us and say, like, this is exactly what we're dealing with. They're telling us about, patients in their practices who have been on HRT for decades. They're not seeing breast cancer rates increase. They see women who are thriving. They're not experiencing, significant decline in age-related bone loss. And yet for years, they've been told it's too risky. So, we can empower women all we want, but like I said earlier, the downstream effect of the WHI is there's an entire generation of physicians that just does not know how to prescribe HRT.